Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balata from Roots Community Health Center, reporting for the week of March 14th, 2022. Today, I'll be talking about long COVID, what it is, what we know, what we don't know, when to worry about it, and what to do about it. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Here in Alameda County, you can see that cases are continuing to come down. Hopefully, we're not seeing a plateau here. And even though it's coming down, it's still not where we were even just this last fall. So hopefully we will continue to see this come down to a reasonable baseline. And in terms of hospitalizations, we are coming down quite nicely with 78 people in the hospital, 7 of those in the ICU. And unfortunately, there were an additional 27 deaths recorded according to the county dashboard. Out of those 27, 20 in the city of Oakland. And that brings us to 1,804 individuals who have lost their lives to COVID-19 in Alameda County. And in terms of who is dying, we have this breakdown for the state of California. It's been relatively consistent that those who are unvaccinated are dying at about 17 times the rate of those who are fully vaccinated and boosted. But of course, we know that death is not the only bad outcome from SARS-CoV-2. We have hospitalization, we have prolonged ICU stays, and we have long COVID. So what is long COVID? The definition for long COVID is not a universal definition. I think that we are still working through what it is exactly, but it does seem clear that this is an emerging crisis that is following in the wake of the COVID-19 crisis, which continues to be an evolving pandemic. And so we are really, unfortunately, looking at really what could be years, decades of impact from this pandemic. So the CDC and the World Health Organization, maybe not surprisingly, have a little different definitions of what they're calling long COVID. And actually, there's a number of different names for long COVID. We've got long COVID, post-acute sequelae of COVID, long haulers syndrome, chronic COVID. We can call it any number of things, and the definitions differ a bit in terms of the time frames that we're talking about. The CDC definition calls out the fact that most people with COVID-19 do get better within weeks, but that some people have symptoms for weeks or more after the initial infection, and that even people who didn't have symptoms when they first got COVID-19 can still have this chronic COVID. And that pretty much sums up the CDC definition. World Health Organization focuses a little bit more on the symptoms and the impairment that is caused by SARS-CoV-2, and says that post-COVID-19 condition happens in those with a history of probable or confirmed SARS-CoV-2, because remember, worldwide, not everyone has as good of access to testing as we do here in the United States. And they're using a 3-month time frame from the initial COVID-19 infection or symptoms, and with at least 2 months worth of symptoms that can't be explained by another diagnosis. It also does call out the most common symptoms, and I'll go into these in a little more detail later, but the World Health Organization specifically calls out fatigue, shortness of breath, and cognitive dysfunction, which is really about the mental processing being impaired. And they also talk about having an impact on everyday functioning. And so a little bit different definitions, but I think one thing I want to point out here is that SARS-CoV-2 is not the only virus that has a post-viral syndrome or consequences. In fact, many viruses and bacteria and fungi and parasites for that matter, have an acute infection. And then some have these post-acute or post-infectious syndromes or other conditions. For example, we know that AIDS is a post-HIV syndrome. And so there's actually an acute HIV, syndrome that happens when you first, or symptoms that you first get if you catch HIV, but then AIDS is really that prolonged or post-viral syndrome. Liver cancer also can result from untreated hepatitis B or hepatitis C. And some of these things we didn't know at the same time that we discovered the infectious agent. We realized the correlation later, like with human papillomavirus, where we realized that that could lead to cervical cancer. And we, didn't make the connection until much later, and that's when there's now a vaccine and so on. And so if we know what the viruses or the infections cause, then not only will we work to prevent that, but we can also be more targeted in how we are looking for those post-viral consequences and how we can treat them. But with long COVID, we still have a lot to learn. So, how common is long COVID? And unfortunately, this is a very challenging question to answer. I don't think we have a firm answer. We have ranges that are actually quite wide. Part of the problem is not everyone gets tested in the first place for COVID. And the other thing is what I mentioned is we don't really have kind of this universal definition just yet. Also, we just had our biggest wave, in January. So we had the most cases of the whole thing, in that surge in January. So we don't know. We don't know the magnitude of it, but there's a lot of work to try to quantify this. We've seen in most of the studies that I reviewed, among pediatrics, we're looking at a 10 to 30% of children getting it may have long COVID symptoms. In adults, they seem to be in the 30 to 60% range of people having some kind of long COVID or prolonged COVID symptoms. And so the American Academy of Physical Medicine and Rehabilitation has created a dashboard that I think is useful. You can actually go on there and plug in your county, your state, and take a look at the estimates. And they made some assumptions, of course, with this estimate. And you can actually change the assumptions if you want. They pull in information from the JAMA Network open source, as well as the Johns Hopkins University case data. They take the surviving cases, so that's the cases minus the deaths, and they also use census data to come up with these estimates. And so you can see here that in the state of California, where there's an estimated 8.9 million people who have survived COVID-19 infection, the estimate for the post-acute sequelae of COVID or long COVID is almost 2.7 million people in California. And that is so far because, of course, we are not done, or let's say COVID is not done with us yet. And so this is just where an estimate of where we may be now. In Alameda County, the estimate of the approximately 265,000 people who survived COVID, the estimate is close to 80,000 individuals who may have long COVID. So again, just estimates, but as we get more information, then these will become more accurate and more sophisticated as time goes on. So a great resource, and the link is in the post. And if we're to kind of continue with the assumptions that they use, then we would estimate about 22,000 people in the city of Oakland may be suffering with long COVID symptoms so far. So what are those symptoms? Well, there are a lot of them. In fact, there's over 200 different symptoms that have been described in different journal articles and so on. But the top four that seem to be rising to the top of all of them are fatigue, shortness of breath, cognitive dysfunction, so those mental processing issues and maybe focus, inability to concentrate, and so on. And then just severe sort of muscle aches and weakness. And so, and within that, there are just a number of different outcomes that we're actually seeing after COVID. And so there is some work to try to categorize them into these different areas like cardiovascular, neurological, gastroenterological, or even with liver and other organs, because really this can affect really any organ systems in the body. So there's some work going on to try to categorize these things. One of the really concerning, I think, post-COVID phenomena that we are unfortunately seeing too much is heart attacks and strokes happening in the weeks after COVID infection. So folks even may think they're completely better and then have a heart attack. And we're seeing this even in people who are younger, like in their 40s, who didn't necessarily have any pre-existing condition at all. And so this is very concerning. And I wanted to point to a large analysis that was done by the U.S. Department of Veterans Affairs. They used their national healthcare database, and they established a cohort of 153,760 people with COVID-19. And then they used two very large control cohorts that were over 5 million people each. They can do this with their large database. And they did this in an effort to estimate the risk and the burden of cardiovascular outcomes. And they found that after 30 days after infection, that those who had COVID-19 were at higher risk of cardiovascular disease in many categories. So they would have irregular heartbeats, heart attacks, myocarditis, heart failure, heart attacks, and strokes. And that these risks and burdens were happening even with those who had not gone to the hospital for their COVID infection. But it was worse with people who did go to the hospital. So basically, they saw these cardiovascular effects after COVID in everyone across the board, from non-hospitalized to hospitalized to ICU, but it got worse from non-hospitalized to hospitalized to ICU in terms of what the burden and the risk was showing. And so these appear to be very substantial risks of cardiovascular disease in those that survive COVID-19. So this is clearly very concerning. Also wanted to point out an article in Science Direct, and this looked at multiple studies. So they were able to take a look at over 80 studies, a meta-analysis, and they were looking here at the cognitive impairment part, so the mental function part, and the fatigue. And what they found was that about 1 in 3 individuals were experiencing fatigue 12 or more weeks after COVID diagnosis, and about 1 in 5 had some kind of cognitive impairment. So this could be impaired memory, impaired focus or concentration, irritability, interference with sleep. And I think we don't even know kind of the mental health and psychiatric implications. Those are very difficult to tease out because we know that just getting sick with it also has its own impact by itself. But definitely the fatigue and cognitive impairment were being seen weeks, months after the initial infection. I know I've dedicated a prior briefing to diabetes and COVID, and I mentioned then, and I'll reiterate here, there seems to be a two-way relationship between COVID and diabetes. So if you have type 2 diabetes, your risk of having a poor outcome with COVID is increased. But also, if you catch COVID, it seems to be causing type 2 diabetes. And so I want to point out a very large study. This was published in JAMA. It included over 2 million people, and it showed that the rate of new type 2 diabetes was about double in those who test positive for COVID-19 compared with those who did not. It's a very large study. The link is in the post. It looked at a number of other things, but this finding around diabetes was rather striking. There's also another large study that I've linked to that showed that those with type 2 diabetes were more likely to have long COVID 2 to 3 months after the initial infection. So a lot we don't understand about the relationship between diabetes and COVID, but it appears to work both ways. And I really emphasize this because diabetes is something that we already see quite a bit of in our community. We already have a high burden of diabetes. So the notion that we could have this other wave coming behind COVID infections is quite daunting, to say the least. Also, another condition that we see a lot of in our community, asthma. And this has also been shown to be associated with long COVID symptoms, especially those related to difficulty breathing and shortness of breath. Still unclear whether this is related to an inflammatory process that we know we are seeing with COVID and post-COVID, or whether this is due to the damage in the lungs that we are often seeing with COVID and post-COVID. So a lot more to be learned there about the correlation with asthma, but that is an underlying condition that does seem to be contributing to long COVID symptoms. Something really important to think about as we think about our young people, because as I mentioned, we are way behind in vaccinating our 5 to 11-year-olds here in Alameda County, only 58%. And that's compared to now 84% of the county population is vaccinated. So we are lagging far behind with our young people, and this is very concerning because we know that if we can decrease the risk of actually catching COVID, then we decrease the likelihood of long COVID. And many of our young people in Oakland in particular do suffer with asthma. So please, parents, this is something to really keep in mind. This is not only about dying or going to the hospital. This is also about quality of life. And speaking of children, there was a study that took a look at over 500 children who'd been previously hospitalized. So now this is a subset of children who got sickest, went to the hospital, but survived. This was published in the European Respiratory Journal. But I bring it up because it showed that, first of all, 25% of those children experienced persistent symptoms months after the hospitalization. But also, almost 1 in 10 were experiencing multi-system involvement. So last week I talked a lot about multi-system impact from COVID in our children. We don't understand why this is happening or who this is going to happen to. We can't predict it. We can't predict which organs, but we know that this is inflammatory and it's related to an inflammation within the blood vessels. So vasculitis is happening, and that is why it could affect just about every organ in the body. And so again, we don't really know exactly why this is happening, which makes it much harder for us to target our interventions and prevention other than to say, avoid catching COVID. Because you obviously can't get long COVID if you don't catch COVID. So when to start worrying that you have long COVID? So again, with the definition being sort of variable, I think that the World Health Organization definition about longer than 3 months seems to be a reasonable one, simply because we do see that people who have symptoms for 6 weeks, 8 weeks following COVID, those seem to just be prolonged effects of the SARS-CoV-2, but those can often resolve. So if you're someone who has had COVID and maybe you caught it in that Omicron wave that we just had, and you still have some symptoms, of course, we're concerned. We want you to be talking with your physician, but also I think we're not necessarily putting it into that long COVID category until after 3 months after the acute infection. And again, this is a bit of I think judgment because there's different definitions flying around everywhere, but this seems to be one that is consistent and reasonable. And at that point is when I think to make sure that you're starting to seek treatment if you have not done so before then. And so what is the treatment? So I think if it's not clear already, there's not going to be probably just like one pill for long COVID because it can affect so many different organs. And so right now, I think the treatment is going to be very dependent on what is the impairment and what organs are affected. So this could mean needing sort of specialty attention, whether that is related to the lungs or the heart, or whether it is neurological impacts. and most of the treatments are going to be based on whatever those symptoms are. The one thing that is showing some promise, and there was a review done in the UK. It was in the UK Health Security Agency Rapid Evidence Briefing, and it was looking at the effectiveness of vaccination against long COVID. The link is in the post. It's pretty extensive, and it looks at different studies that have a little bit different conclusions. I think the bottom line is a couple things. First, I'll say that if you are vaccinated, then your chances of catching COVID are reduced. And so that needs to be taken into account. That was not taken into account in this particular review. And so therefore, this review is not for the purposes of coming up with any kind of population estimates or anything like that. It was actually to look at those who caught long COVID, what was going on with their vaccination status. And what they found is that the vaccine does not eliminate the risk of long COVID, but it does seem to reduce the risk of long COVID, and it also seems to reduce certain symptoms of long COVID, including the fatigue and headache that we're seeing most commonly. The other thing that it shows, and it's not consistent across the board, but it is that vaccination can actually relieve some symptoms of long COVID. So for those who had not been vaccinated yet, caught COVID, and have long COVID, the vaccine can actually help eliminate those symptoms. And it's not entirely clear why. And one thought is that there's some sort of low level amount of virus that is still present. And so that by getting vaccinated, it sort of gives you that challenge or that boost, if you will, that you need to then mount enough of an antibody response to clear whatever is remaining in the body. So for those of you or anyone that you care about that has long COVID and was never vaccinated, the vaccine may actually help with those long COVID symptoms. So again, if you're vaccinated, you're less likely to catch COVID, meaning you're less likely to then get long COVID. If you do happen to catch COVID and get long COVID, it does appear that these symptoms are reduced by virtue of having been vaccinated. And if you were never vaccinated and have long COVID, then the vaccine can actually reduce the symptoms of long COVID. So that is definitely something to consider. So beyond that, I think the other things to think about is how to rehabilitate or how to self-manage some of these symptoms that you may be experiencing after COVID infection. So I think most of them are probably common sense kind of things. Don't push it. Don't overexert yourself. If you've had COVID recently and you find that you're getting winded, maybe don't push it so much. Don't, just try to take it easy a little bit, because you may be having some residual effects on the heart or lungs that may be causing that feeling of being fatigued or getting winded and so forth. So don't push it. Likewise, mentally, don't think that you can just go right back to how you were perhaps before the infection. Realize that this can have some lingering effects. We hear people talk about brain fog or difficulty concentrating. So maybe instead of trying to do 5 things at once, try to focus on one thing at a time and work your way back into the activities that you were doing before. A lot of sleep disturbance is happening with long COVID. So we're going to want to look at your sleep patterns and do all the things that we would do for anyone who is experiencing difficulty sleeping, and looking at sleep hygiene, making sure it's very dark, you have a rhythm to your sleep habits, and so on. And the other thing I want to mention is that there are post-COVID care centers that are opening all over the nation. Almost every state has them now. Here in the Bay Area, we've got UCSF and Stanford that have post-COVID care centers. I put a link in the post to survivorcorps.com, and they are basically maintaining this map and this list of resources. It tells you how you can reach them and make an appointment. There's even virtual post-COVID care centers that may be worth checking out. There are also a number of different resources and support groups. I put a couple of them in the post. I'm not per se endorsing one over the other. They seem to be many great resources for both the research that's going on right now, and there's a lot of research going on right now, a lot of investment being made in trying to understand long COVID, but there's also opportunities for peer support and for folks to exchange and share what is working for them, and also, any experts in the field that are having success treating long COVID. And it's going to be very important that if you have long COVID, that you have a primary care physician that can help to coordinate if you are going to need to see specialists, if you are going to need studies, like let's say an EKG or other screenings, neurological screenings and things like that. Those are best done with your primary care provider, because it always works better to get a referral from your primary care provider to try to go to see a specialist or to go to one of these long COVID type of clinics. And so remember that to prevent the most severe and tragic outcomes of COVID-19, vaccine and booster are still remarkably effective at preventing death and hospitalization, but now also we see in reducing the incidence and severity of long COVID as well. And so we have to remember that as I mentioned last week, we're concerned about long COVID at any age. But when it comes to our children, we, can anticipate that hopefully they have many decades of life ahead of them, and we don't want to do anything to put them at risk of having the highest quality of life possible. And so this notion that it's okay for kids to catch and then catch again SARS-CoV-2, I think we really need to rethink that. I think we need to protect everyone, but especially our children, because we don't want to find out, like we've done with HPV and others, years down the road, that we have an early onset of a cancer or neurologic dysfunction or something like that. We don't want to be blindsided by that. I think there's a lot we don't know, but we know enough to know that this is not something we want to play around with or risk for no good reason. And we also know that just because you've had COVID once doesn't mean you can't get it again. So we are seeing people being reinfected. And so once again, the vaccine can certainly reduce your chances of getting reinfected, but more importantly, can reduce your chances of a severe outcome and even reduce the severity of long COVID. So remember to eat a balanced diet, get some exercise. Those vitamin bottles, are they collecting dust? Make sure you are taking a multivitamin supplement every day. Consider additional vitamin D supplementation. We do not want anybody to be vitamin D deficient. Now's a great time to go see your doctor if you haven't done so in a while. And while you're getting those baseline labs, check your vitamin D. This is an opportunity to do that along with your sugar, cholesterol, and everything else. Manage your stress and get a good night's sleep. Thank you for joining us, and we look forward to seeing you next Tuesday at 10 a.m. See you then.